Why is it so hard to teach and learn epidural anesthesia? Epidural is one of the most critical and most stressful skills we train in anesthesiology, and yet every supervisor knows the frustration. Your resident is holding the TUI needle, sweating and asking, was that the loss of resistance? And you can't feel what they feel. You can't see what they feel either. Epidural placement is a blind procedure. There's no ultrasound screen, there's no nerve stimulator, no visual confirmation, just a syringe, plunger, and the hope that your tactile senses are sharp. Now think about it from a teaching perspective. When you supervise an ultrasound-guided regional block, it's collaborative. You see the anatomy, you see the needle, you guide the resident in real time. But with an epidural, you're sitting next to them, hoping that they feel the pop, hoping that they are in the epidural space, not too shallow, not too deep. And when the patient has a difficult anatomy, morbid obesity, scoliosis, or prior spine surgery, it's even more uncertain. And your resident is guessing. You're guessing too. And the patient, they're the ones taking the risk. This matters not just for the learning curves, but also for safety, efficacy, and confidence in clinical practice. Failed epidurals, accidental dural punctures, or even intravascular injections often stem from this lack of precise feedback. And in high-pressure environments such as labor wards, trauma cases, emergency cesarean sections, that uncertainty can cost critical minutes. As educators, we need better tools, not just to improve learning, but also to make every epidural attempt safer and more consistent. That's exactly where Flat Medical's EpiFaith Smart Syringe steps in. This isn't a new technique. It's just a better tool for the techniques we already use. The EpiFaith Smart Syringe transforms the subjective feel of loss of resistance into an objective visible signal. It's a preloaded syringe filled with air or saline, just like standard practice, but with one major difference. It has a built-in visual indicator that responds in real time. And here's what happens. As you apply the pressure on the plunger and while advancing the TUI needle, the system remains static until the tip enters the epidural space. At that point, when the true loss of resistance occurs, the plunger automatically advances and a visual marker confirms the entry. And that moment is no longer only felt, it's seen. You, the supervisor, can confirm. The resident can learn too. The teaching becomes observable, consistent, and dramatically less stressful and more objective. Now let's go back to those difficult cases: obese patients, distorted spinal landmarks, and prior surgeries. In these scenarios, tactile feedback becomes unreliable. But the EpiFaith Smart Syringe still works because it's not relying on your feel. It measures true pressure dynamics and provides visual confirmation when the tip enters the epidural space. In my opinion, for training programs and educators, this could be a game changer. It reduces the learning curve, it boosts residents' confidence, and it gives attending physicians real-time insight into what's happening, even when you're not holding a needle. It somehow bridges that gap between knowing and doing, and it turns a subjective moment into a teachable, reproducible step. Epidural anesthesia isn't going away anywhere. But how we teach and perform it has to evolve. The EpiFaith Smart Syringe by Flat Medical brings visual clarity, confidence, and control to one of the most challenging procedures we do. For objective improvements in education, patient safety, and more consistent clinical outcome with epidurals, the EpiFaith Smart Syringe by Flat Medical brings clarity, confidence, and control to one of the most challenging procedures we do. I hope you like this information, and if you do, be sure to subscribe to our channel and never miss the future videos. Until next time.